during your revolution days, was there any moment when you, or maybe, I mean, I would say actually during your career, was it, how often did you come to the point where you say, you know what, I wish someone told me this before so I can use it, so I would have been smarter, or I would have done something differently. Is there, I mean, it's probably very difficult to come up with a single advice to an entrepreneur trying to start something, but is there anything that you would?
Yeah, I would say that every day, and the challenge was to kind of parse that back and say, wait a minute, which of these things are really tangible? Because as you work your way through and follow the water all the way down to the lowest point, you start realizing and learning stuff. Let me, as an example, when we designed Oxford, the Hollywood High concept, if you will, was what would happen if we built a yuppie HMO? What would happen if we literally built like a niche HMO, like first class, and we charged more for it? It became a nice business. Well, what happened is the insight that came from that was, when it comes to health, everybody wants the best. So all of a sudden we realized, my God, our Medicaid business was booming. Our Medicare business was booming. Everybody wanted the best. We would walk into the streets of Brooklyn and we would turn to them and say, you can have the same benefit plan that the people from Morgan Stanley just got. One of the insights the most prescient insights that I ever learned, and I'll give you a couple of them because I still use them, is McKinsey in 1986 said healthcare is and will remain a local game. That was reinforced years later by the Dartmouth Health Atlas. We're victims of our own geography. And that's an interesting thing for any of you who are ever suffering from illness or have a parent or family friend who's suffering from illness, is get them out of their geography. Do you know that you're 3 times more likely to have back surgery if you live in the West Coast than if you live in the East? I know someone who died on the operating table in Ojai, California, who probably would have never been operated on if they were in Bergen County. So second opinions, third opinions, get them outside of the geography you live in. But healthcare is and will remain a local game. So the business of Oxford Health Plans was structured and built at the local level. We needed to be as local as Sal's Pizza. You interview anybody you ever meet who ever worked at Oxford, they will know those words because I used to pound it on them every day. We have to be as local as Sal's Pizza. Sal doesn't have money to run a billboard down here in Times Square. He's in Queens, you know, on 1 Avenue. And that's what we're competing with. And you better be that local. So we actually structured our organization around the care delivery, around and the distribution system to literally be that local. And we used to measure ourselves on our success by neighborhood.
So it's like a network.
I'll give an example. I was in big data before big data even anybody knew what the term was. Give an example. And this is another thing that you can use as insight. By looking neighborhood level, we started seeing a run on cancer claims in Brooklyn, around Coney Island. Started digging into those claims and realizing that all we had to do was add 1 line to the enrollment form that asked where you were from. And we discovered that many of these people were from areas near Chernobyl. So we put them immediately into instant call programs. Now, understand the ethnicity of the people you're dealing with. That community, coming out of Russia, what's the mindset? Screw the government. When the government calls, uh-oh, right? So you have to figure out how to put the olive branch out to communicate with an audience. You need to understand that the United States is another thing I learned a long time ago. We are not a melting pot, we are a mosaic. Latinas who come here from Caracas are very different than those who come from Mexico. They have different political views, they have different economic views, and so you have to literally understand those micro markets, which links itself to another thing I understood. And we built some of these things when we were doing some businesses for United, was Kenichi Omai was a guy who worked also at McKinsey, ironically. Geez, I always give them crap for not being that bright, but I guess a couple of guys are. that it was called The Marketing Triad. It's a wonderful book, and it basically said that someone who lives like in the suburb of Detroit would be more like somebody who lives in the suburb of Beijing than they would somebody who lives 30 miles further out in like Plymouth. And so we started creating horizontal and vertical looks at the populations of people based on their aspirations, expectations, needs. So we created, for example, one of the things we did at Oxford was we created a Chinese marketing initiative. We went down to Chinatown. We cut a deal with the Chinese Medical Society, and I'm telling you this because you have to understand the payment of money too and how it all works. We cut a deal with the Chinese Medical Society. Why? What's you know that one of the fundamental issues with the Chinese population in downtown is they all pass the ID card to each other? So when you get down to the monetization, one person buys a card and they sell it off for $10 a use, and everybody goes into the doctor's office using, like, everybody's a United member. Next thing you know, there's a massive run on United claims on the one person, right? So it's fraud, but you're not going to catch it. So what we did is we cut a deal with the medical community. We globally capitated the community. Again, understand the velocity of money, understand who gets paid, how they get paid, and where the risk is. We pushed the risk down to its furthest level, which was at the doctor level, right? We opened a enrollment center in partnership with the local bank down in Chinatown. And so we actually had an ability and every Wednesday we would bring in movies from Guangzhou. And we had ambassador programs where people were like bringing their friends to the movie theater because they wanted to see what was from the homeland. And we started continually connecting with people, and we did the same thing. I had a program growing in Brooklyn with the Yiddish community. It was called Stop Kvetching, Start Stretching. And we implemented the same program in suburbs throughout America where the ethnicity basically said this works. So that's the part that I'm saying to you is we're a mosaic, not a melting pot. That you must get, healthcare is extremely local. It is very personal. And if you build a business with that insight, my other thing that we learned, and I've seen over time, and you'll see it again, right? It's coming right now. When I started in healthcare with Oxford, there were 638 HMOs in the United States. By the time 8 years later, we had all rolled each other up. I think there may have been like 12 really, and maybe like 40 little bit players. We used to literally market that we ran Bergen, Essex, Passaic, somebody else had the next Somerset, somebody else, and you'd point to the other health plan. Well, then we started rolling each other up. Well, what's going on right now with accountable care organizations is we're going back to that within the regulations. You know what an accountable care organization is? These are when the hospitals are organized. So each hospital is basically becoming a health plan. We're getting local again. There will be another roll-up. But along the way, here's an insight. Doctors can only treat what they see. Hospitals can only monetize what they see. All of a sudden, you're now putting them on the risk for people they have no clue who they are and have never seen. I want to talk about bigger business opportunities is educate, work on programs that engage and connect a hospital to its community in the ways that it used to be connected back in the 1940s when it actually had legitimacy to being a not-for-profit status. Because that's another big issue is, if everybody's actually paid for, why are you not-for-profit?